Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other MDs and DOs to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with MDs and DOs since 2012. My passion for root cause medicine and physician advocacy drives me to help MDs and DOs who have incorporated functional and integrative medicine into their practices. So let's dive in. Hello, and welcome to the Functional and Integrative Medicine Podcast. I am thrilled to introduce Dr. Jack, the visionary behind Aesthetics21, a name synonymous with empowerment, innovation, and the art of enhancing natural beauty. Aesthetics21 was born from Dr. Jack's profound passion for helping people look and feel their best at every stage of life. It's more than just a med spa, it's a philosophy, combining cutting-edge regenerative medicine, advanced aesthetics, and a commitment to holistic wellness. Aesthetics21 bridges the gap between beauty and health, offering clients natural, personalized, and transformative care. The name Aesthetics21 reflects this harmonious blend. The word aesthetics represents the artistry of enhancing natural beauty, while 21 symbolizes vitality, youth, and modern sophistication, all grounded in 21st century advancements. Dr. Jack's expertise lies in science-based treatments like PRP, exosomes, and stem cell therapies to empower the body's natural ability to heal and rejuvenate. At Aesthetics21, it's not just about looking great, it's about achieving harmony between appearance and overall well-being. Join us as we dive into Dr. Jack's journey, the vision behind Aesthetics21, and how he's transforming lives by redefining what it means to age gracefully. Get ready to be inspired, educated, and empowered. And welcome to the show, Dr. Jack.
All right, thank you very much. I appreciate it.
We're excited to have you. And I met you at A4M at the Integrative Medicine Longevity Fest, they called it. And I really just loved your philosophy and everything that you're doing out there in New York. So we're going to dive right in and tell us a little bit about your professional background and what led you to the world of functional or integrative medicine.
Oh, thank you. I appreciate it. It was a great time meeting you, and it was my first time at A4M. It was like an awesome experience. It's like I was like a kid in a candy store. It was like all these little machines and all these little, all these like fun things that you could actually play with and everything like that. And actually, I broke my ankle like in September, and I was just kind of at the time when I'm starting to walk. So like when I was walking around, it was just like I was just pretty much trying to go to my own like little like technology clinic, just going to every single booth trying to see who can actually help me heal my ankle faster. So it was pretty awesome. But it was my first time at A4M.
Very cool.
Yeah. So my background is I'm from New York. I initially got into surgery, and if you see me in real life, I'm like 6'4", 6'5", and I initially wanted to do orthopedics. I look like I have an orthopedic build, and unfortunately, I didn't match into that. So initially, I was in general surgery. And general surgeries, you get to do a lot of different specialties. You cover a lot of different specialties in the surgical floor. But the first time I kind of actually knew I kind of wanted to, at least aesthetics and kind of like knowing about like actually like the product of what I'm doing was when I had to like take care of one of my first patient as an intern in the emergency room who had a car accident because I was at a level 1 trauma center, and she had a big gash all the way down her face, going down to her neck, and she was relatively young. And at that time it's like 3:00 in the morning. They're like, all right, intern, go take care of that and get her discharged. So I took my time. It took my time. I took like an hour or two, just like going through each layer, trying to make sure that I can do the best thing I can for her, because this is like on her face. And then when she came back for a follow-up appointment, when I saw actually how good of a job I did, I was quite impressed on what I can actually do with my hands. And also my attendings were like, they actually were like, wow, that we could barely tell that she had an injury with the scar, and that was just a couple of weeks later. So that's when I kind of started like thinking about aesthetics. And as my training went on, I Initially, was doing general surgery, and then I switched over to actually pain management um, around the time of the pandemic. And when I was doing pain management, that was like the first time I was focusing mostly on musculoskeletal injuries, because I still had a love for orthopedics, and I still loved sports injuries, and knee pain and shoulder pain, and I was doing most of those things. And that's when I first started getting into kind of like more non-surgical pathologies and stuff like that. And then I was also doing, you know, PRP, stem cells. And at that time, that's when I started getting into it, just learning more about it. And then from the regenerative medicine aspect of pain management, that's how I started learning more about it, because you don't really learn a lot of this stuff about in medical school or residencies. And
Right.
and as I started helping more patients, I started looking at what other ways I can help patients with this kind of regenerative medicine therapies. And then that's when I started getting into aesthetics, and I started doing just a little bit of some Botox parties, and just doing a little bit of some light aesthetics. And then when I started looking how these things correlated together, that's when I started really appreciating the fact of how much you can do with regenerative medicine and aesthetics. So then
Yes.
there, it just was like built upon itself from there, and I just started getting into hair, face, body, and then I started taking a lot of classes, and I just started just immersing myself into just like this different side of the world that I never really um, you know, got into. And in this, aesthetic medicine in general and regenerative medicine, there's no like governing body for it, right? Like,
Right.
it's you have your when you go to medical school, you go to residencies, you learn, you go to residency, you fellowship, and then you're out and you're doing that, maybe work in a hospital, maybe private practice, but they don't really, but there's no real, you know, post residency kind of aesthetic life, except if you're a dermatologist or like a plastic surgeon.
Right.
And and the great thing about this field is that it's so expanding. Obviously, with it being so expanded, there's a lot of people in it that maybe shouldn't be in it, but at the end of the day, there's just so many more opportunities and so many things to learn and to get into. And when I started taking more classes, that's when I kind of started learning more about this kind of functional medicine kind of thing, where they want to focus on the root cause, and identify how everything started. And especially coming from me, coming from surgery, where it's like you get the instant gratification of helping somebody right away, to kind of this, now you're trying to kind of take that, and you're incorporating that with like find out why they're there, and why this is happening in the first place. So it was a
Right.
nice little like mixture of those two. So as I don't call myself like, I'm a doctor. I don't really say I'm in functional medicine or in integrative medicine particularly, because at the end of the day, I still believe in science. I still believe
Of
in
course.
evidence-based medicine, but I just look at it a little bit differently. And like every when a patients come to see me, and I give them their whole like beauty plan, or they come for like a pain or whatever, I always tell them like, this is just, I'm like a painter. I can't paint in real life, but I could I can draw a picture of how I feel I can help you out. And it's I have my own vision of how I feel we can help you. And in
Right.
my bag, it's not just the Botox and the fillers. It's also I like to throw in stem cells and PRP and biostimulators, and then peptides, and then go into the fact of like, what are you taking? Like, are you taking collagen supplements, or how are you taking care of your body? Because at the end of the day, you don't want to be like a car, like a beat down car with a nice exterior, right? So at the end of the day, you want to make sure that the whole vehicle is a luxury vehicle, I guess, if you want to say it that way. And
Yes.
and every step of the way, as a physician, you have an opportunity to kind of help with multiple different facets, not just coming in like a lot of time in surgery. You come in, we fix this one thing, you're gone. Now it's like, I am still procedural, and I still like to help patients with procedures and different kind of things I do. But also I do take into the fact about what are they like, what are they doing to also help take care of themselves. So that's kind of like,
And I love that. I created this podcast for MDs and DOs because I have found that traditional allopathic MDs like yourself are really looking for more, and you guys tend to be learners by nature. And I love working with the MDs and DOs that are really looking at root cause, holistic types of treatments, functional, integrative, because it is treating the whole person, right? And I think the old way of medicine, which is just treating the symptom, that's still a lot happening in the world of allopathic medicine. But especially you younger MDs and DOs, man, you guys are like, we want to learn the latest and greatest. We want to know about nutrition. We want to learn about all these things that they didn't teach us in med school. So that's why I started this show, to let other MDs and DOs know that, hey, this is, the wave of the future. This is what is the new, what people are looking for. This is what people want. And this is what brings real, true healing to people. So that's going to lead me to the next question for you, which is, how has practicing, kind of a functional and integrative medicine approach influenced your personal approach to health and wellness?
Well, I'll just say, like, life's all about options, and I'm a big proponent on information. At the end of the day, like, if you see a surgeon, that's what they do every day. Like, they're gonna tell you there's surgical options. If you're gonna see, a certain type of doctor, they're gonna tell you what they've learned, and there's nothing wrong with that. But with me learning about different avenues of how to treat patients and how to try to give more effective treatments, I'm a big fan of combination therapies, and just about trying to figure out a kind of a holistic kind of view on how to help somebody, not just in one way. So I'll just say, like, for me, it's just mostly just trying to just learning more and getting more information, and trying to be able to kind of help patients, not just in one way, in multiple different ways, because a lot of these things bleed into different things. So
Yes.
that's why, when I think I started with, one of the classes I took uh was like was I think it was like weight loss or something. And then from weight loss, I started learning about different things about weight loss, and then all of a sudden it's like you get into hormones. And then in hormones, you're like, oh, okay. Then you learn about sexual wellness. And I'm like, okay,
Mm-hmm.
well, wow, the sexual wellness. And then from sexual wellness, you start learning about peptides. Then from you're like, oh, well, PT141, I never heard about that. Then you learn about other peptides that help. And then it's just like a slippery, it's like a snowball effect. And you just keep learning on how all these things are connected. And then when you get patients that come in, a lot of times they have like they come in for one thing, but it could be just something else that could be demonstrating as that. So it's at the end of the day, it's just like, I just try to do whatever I can, with whatever knowledge I can, and try to help patients the best way I can with the knowledge. I'm just like, every single day I'm learning something new. I'm going to
Love it.
conferences like the A4M and doing lectures, and I'm just trying to do my best and like how to, treat patients the best way, and just give them like an empathetic way, because people are looking for this. People are looking for
They are.
natural alternatives to the standard of care. So, and
Agreed.
there's nothing wrong with the standard of care. Like I said, like, I'm based in surgery, but like there are other options, and people deserve to know their options.
Absolutely.
Yeah.
All right. So I'm sure adopting a new approach brought challenges. What challenges did you run into, and how did you navigate those, especially early on?
Well, I think to be honest, just getting into this, when leaving surgery to do pain management, I did do orthopedic, like, house shifts and stuff like that in training. And I think the first time I was doing like gel injections or visco supplementation with hyaluronic acid and PRP and stem cells, you know, I wasn't sure how much it actually helped patients and how much it made differences in patients. Like, when I first was giving it, I thought it was going to be some mild relief from the pain, but after doing these injections for almost 7 years, um, I was like, oh yeah, I guess I'm seeing these patients come in with like so much pain they can barely walk, and then injecting them with whichever way that we went with the stem cells or with the PRP or with injuries that they went to multiple different places, and they weren't able to get a straight answer approach, or like the patients I usually see, or I get three types of patients in my pain clinic. I get patients who don't want surgery, who can't have surgery, or would do surgery as the last option. And and giving those patients, like I said, is all about options. Everyone doesn't want to have surgery, but giving them the option for these non-surgical interventions was like very, very eye-opening to see about how much it actually helps people every single day. And I built many relationships with people who couldn't walk, but I'm like not like a god, but I'm like someone very important to a lot of people's lives just because of the change I was able to help them with my pain management interventions.
Very cool. So the challenge was not being sure if these new techniques were going to work, and then finally seeing them working really probably must have made you really happy.
Yeah, because like if you look at even if you look at the indications for, the indication for a knee replacement is pain.
Right.
Arthritis, it's not just arthritis. If you have arthritis, you have no pain. That's not an indication for a knee replacement. So if you have pain if you have pain and arthritis, that's usually an indication, just being very, loose about it, but that's the indication for surgery. But that's
Mm-hmm.
also the indication for a non-surgical intervention as well. And then, when I was first starting out, it was just like, oh, you got a steroid, you got 2 steroids. Oh, that's it. You need to have surgery. But, sometimes there are people who want to have a decision on if they want to go through having surgery. Maybe they have, they don't want to go through the recovery, or maybe, because of health reasons they can't. Maybe they're really young. They can't promise you a knee replacement is not going to be replaced after 10 or 15 years. And as much as surgery is amazing, the knee surgery is an amazing procedure. Some people need to know they have other options. And I just didn't really, buy how much these injections helped. And then after, doing the injections on patients, so I can so anecdotally, and then looking at the research, and just in the last like 5 years, the research, especially in like PRP, has been amazing, and it has shown so much benefit for a lot of people who want to, if they got meniscus tears or if they got arthritis, to help them with what they're going with their pain. And just seeing that, close up and face to face, it was kind of a really big testament about just the other options besides what you're normally taught in, residency or training, in the hospital.
Right. Well, that kind of leads into my next question. So, what do you wish someone had told you when you first started practicing this way? What advice would you give to MDs and DOs who are thinking about adopting this approach to medicine?
I'll just say, just be open. Just be open to other things. Like, it's at the end of the day, we're trying to help patients. Everything doesn't have to be in a specific algorithm, and as long as you have, you go through with an evidence-based medicine, but also with the open mind. These things do help people. I'm a really, really big person about, benefit risk ratio.
Mm,
So, everything you do as a doctor is, do no harm.
right.
And everything, you have an impact on a lot of people. A lot of people looking for you for your knowledge. They're looking for you to help them. They're in a very vulnerable time. And at the end of the day, I just think to myself, like, I don't want to hurt anybody. I want to make sure I can do the best for the patients. And then it's always about risk versus benefits. And when I usually talk to my patients very in depthly about what the possibilities of these interventions are, what the side effects are, and especially with things like PRP stem cells, I 100% always tell them it's not guaranteed. They're, you can see a lot of time they're paying out of pocket, and this is hard-earned money that they have, and you got to let them know like what they're getting themselves into. But a lot of the stuff you got to let them know the upside and the downside about it. But I just think that at the end of the day is you just try to educate yourself and try to be open to other things. Like there's a lot of Eastern and alternative medicine stuff that seems pretty cool, and you guys got to weigh it out. I won't tell anybody no unless I think that's going to actually hurt them. And then, if I don't know enough about it, I'll just say I don't know enough about it for me to really judge about it. But, I'm very big into just being open to, to things that help the patient. Because at the end of the day, it's the end. We want to help the patients. We want to make sure that patients are healthier, they're happier, and they're pain free. For my pain clinic. So that's
I
that's
love
that's my goal.
I love that. Stay open, be open. I have found, with working with physicians for the last 12 years that, there's two different types. There's the types that are open and constant learners. And then there's the type that are like, I did 15 years of med school, residency, fellowship, and, I kind of know it all and I'm not interested in learning anything else. And I think that, that's detrimental to them and to their patients because, like you said, there's so much out there and nobody knows it all. So, remaining open, I think, is a great advice.
Yeah, 100%. It's like if you really think about it, like think about like GLP-1s, which is I think that's like one of my favorite things that has come out in the last 20 years just because of how I directly work with it. But
Okay.
I actually got into med school from high school. And so all my friends, my sister, all of my friends are like in the medical field pretty much. And and at the end of the day, they all have different specialties. My sister's a neurosurgeon, you got my friends that are anesthesia, you got interventional radiology, orthopedics. I got a lot of friends in a lot of different areas. But like you would think that, you would know more about these medications, but a lot of times they are the people I go to if I need help with what they're doing. But like with things like, I have to also dispel a lot of myths about like Ozempic, like, people don't really know. It's been out for almost, the GLP-1 medication's been out for almost 20 years.
Mm,
A lot of the problems with the medications is all because of, not because of the actual medications, because of what happens from taking the medication from like rapid weight loss.
mm-hmm.
And a lot of these things are out there that, but just if you're not looking at it, if you're looking at like my sister's does a lot of vascular stuff and you're doing the stroke stuff, like you're not going to be going to PubMed and looking up, what does Ozempic do for the body, but like,
Right.
but that's why, I teach my friends about a lot of stuff that I'm learning that we never learned in medical school or residencies and stuff like that. And it's like a learning experience for them because it's like I have the very fortunate opportunity to be able to go into PubMed and look at the research on PRP and look at the what's the newest research on the Ozempic, so the new GLP-1s, and I get excited about it. Like I get excited about all the biohacking and all these different tools to help patients. So that's like kind of what my passion is. So I'm able to learn that stuff, and these are things I not only teach my patients, I also teach my friends and my family about it. And maybe they might get a little sick of it sometimes, but like, but that's my passion, and this is what my passion is right now. And so I'm trying to
I
be
love
able
it.
to take two worlds and bring it all together, and still be true and be safe with my patients.
I love it. What trends in functional and integrative medicine are you most excited about right now?
Um, I think the GLP-1s are amazing. I think these things, it's just what it does, and you just see all these new data on it. And GLP-1s is just like it's like a subset of what I'm interested in, like a lot about peptides and also about regenerative medicine. I'm all about biostimulators. I'm all about stem cells and PRP and exosomes to see exactly where those are going. Um, and peptides especially because it's just like GLP-1s are the most famous one, but insulin's it's a peptide. Like there's a lot of peptides that are out there for so many different things, for performance, for recovery, for sleep, for immunity, for all these things. And the safety profile is quite safe.
Yeah.
Well, I say except for if you're
I'm a,
getting your peptides from like an unknown place in China or something like that. But
yeah, don't do that.
but like like as long as you go to like yeah, don't do that, don't do that. Like that's why I always tell any weapon you have, any medication you have is only as good as the person who wields it. And that's why
Right.
you should go to a physician. You should go to somebody who knows about these things, who can at least help you choose safe medications. And also, like I use FDA monitored pharmacies that are monitored by the FDA, so I know that the quality is up to a certain standard.
Great.
And yes, red light therapy, amazing.
I know, right? I
That's
was
like
going to say you're probably using that in your practice.
yeah, 100%. Like I got red light caps, I got red light masks, red light
Love it.
panels, and just to know like how red light even came about when that it looks. I read that it started out when they were trying to figure out a way to help heal astronauts back in the day, and they were trying to look at different light spectrums.
Yeah.
And red light therapy was one of them. Red light, blue light, green light.
Hmm.
So like it's just amazing on how like these little technology things can like really help people.
And it's funny because a lot of stuff that's coming out now that's kind of like the newest and latest and greatest, like the mitochondrial health and the quantum biology and, blocking, blue light. I was talking to somebody recently about that, and I'm like, blue blockers have been around since the 30 years. NASA made them a long time
Yeah.
ago. NASA knew a long time ago that blue light was bad for us, and EMF. So, there's just so much cool stuff coming up. So it's exciting, and I love that you're, into it all. If there was one message you want listeners to take away about functional and integrative medicine, what would it be?
Do your research. Just joking. Just really just be open. Just be open to change and to be open to the future. And there's a lot of technology and medicine moves at a very fast pace. And as much as you have to be open, but try to do your best to be as evidence based as possible. And and one of the hardest thing for me is just not to get too excited for some of these new technologies and just try to actually like I said, it's all about the patient, and you have to always look at the risk benefit profile, and but just being open to to medicine in general, because there's just so many. The world is just so big, and it's all intertwined. So I would just
I
say,
love that.
just for
I
anybody,
love
just
that.
to kind of bring those things together.
And do your research. I love that you shared that because, I'm all about evidence-based science. And that's one of the reasons why I really love working with MDs and DOs that are doing functional and integrative medicine. Not that I have anything against any other type of clinician that's doing functional and integrative medicine, but I like the fact that you're an MD first, right? You can treat the whole person. And now you've integrated all of these holistic and root cause treatments into your practice. So I think it's like the physician on steroids, right? It's like the best of the best. And thank you so much for taking the time today to be with us, Dr. Jack. I know how busy you are. And I just want to let the listeners know, if you're in New York and you need help with anything to do with wellness, pain management, aesthetics, you can hook up with Dr. Jax at, tell us your website. Is it aesthetics21.com?
Aesthetics21.com, yeah.
That's him. So reach out to him and he'll be able to help you on your way. Thank you again. And for being on the show, I really appreciate it.